My name is Jay Fassbender. I'm from Daphne, Alabama, and I have MMN, Multifocal Motor Neuropathy. I'm a former firefighter and paramedic. In the fire service, we say two in and two out, right? We go into a burning building, you don't go alone, you have a partner. 32 years in the fire service, that is my mindset. Unfortunately, due to this disease, I lost my career, but I still have that partner. There's another person in that fire with me, right? And that partner is Soleo Health. I have a rare form of a rare disease. Multifocal motor neuropathy is a degenerative nerve disease. It's autoimmune driven. It's progressive. The nerve signal to the muscles is interrupted. The muscles degrade over time due to lack of that signal, and there's no remission for this disease. My disease started with literally just a numbness in the hands and some cramping, to within 6 weeks I was unable to walk. It progressed to the point where I became a full quadriplegic.
All right, there you go. Go work hard.
I've been a Soleo patient for 3 years. My first introduction to Soleo Health was I was sent home after my first hospitalization to receive IVIG, and Soleo was luck of the draw. And a nurse showed up at my home and started my series of treatments. She was very good at explaining the medication, what I should expect for side effects. Fast forward a couple of weeks, I was due for another round of the medication. The nurse showed up at the house. What she noticed is that actually I was sicker, and ultimately, due to her actions and her awareness, I was back in the hospital the next day. That quality of care, that level of recognition, that's valuable, right? That's part of that partnership that I think all of us as patients need. I was given the blessing to return home, and one of their questions was, where do you want to receive your infusions? And at that point I knew the answer was easy. I asked for Soleo, not only just Soleo, but I asked for that first nurse. I was at a stage of my illness, fighting depression, staring at four walls, and so I requested that I actually come to an infusion suite. For my own mental health, I needed to have that experience of getting out the house. During that transition from home infusions to the infusion suite, not only did they take care of it, but it was so seamless. I knew they were battling behind the scenes, but that problem was solved because of the skill, the knowledge, and the expertise that Soleo brings to the table. For somebody with a rare disease like what I have, resources are everything. My drug has to be renewed at this point every 3 months. If there's a disruption, I actually start getting sick very rapidly. So for me just to show up on infusion day is great, but my pharmacist has had to work hard just to make that happen every 2 weeks. That takes that stress off of me. I don't have to worry if when I show up is my medication going to be there, because I know I'm a special circumstance. I know there's extra work, but Soleo meets that challenge and takes care of it. With Soleo, I have a higher quality of life. I walk again. Without them, I don't know where I would be. Soleo Health simplifies my complex care by putting in the work behind the scenes, making sure I receive my medication and my infusions on time, so I can focus on living my best life, which is the most important part of all. I may have this disease, but this disease doesn't have me.